I've spent the better part of my life under the harsh, fluorescent lights of a hospital, seeing things that change you. As a cardiologist with more than 3 decades of experience, I've held the hands of patients in their most vulnerable moments, and I've had to deliver news to families that shatters their world in an instant. And I need to tell you something, a truth that is tragically overlooked in our society, and even in our medical textbooks. Heart disease is the #1 killer of women in the United States. According to the American Heart Association, it claims more lives than all forms of cancer combined. Yet, we are still living in the shadow of a profound and dangerous misunderstanding. We have been taught, through movies, television, and outdated medical training, to look for the Hollywood heart attack. The dramatic scene of a man clutching his chest, gasping for air, and falling to the floor. While that certainly happens, for millions of women, especially those over the age of 60, a heart attack arrives in disguise. It is a silent, subtle guest that mimics other, more benign conditions. It whispers instead of shouts. And because its symptoms are so easily dismissed, so frequently ignored, it is often far more deadly. The reason for this goes back decades. For a long time, cardiac research was conducted almost exclusively on men. The results, the symptom lists, the treatment protocols, they were all based on a male physiology. Women were often excluded from these studies, and the medical community created a one-size-fits-all model for a condition that is anything but. The brutal consequence is that today, women are more likely than men to die within a year of their first heart attack. Why? Because they don't recognize the signs until the damage is catastrophic. They waste precious, life-saving minutes, even hours, telling themselves it's just stress, indigestion, the flu, or simply the inevitable aches and pains of getting older. They are often caregivers, conditioned to put the needs of their spouse, their children, and their grandchildren before their own. They don't want to be a bother. They don't want to raise a false alarm. And that hesitation, born from a lifetime of nurturing others, can be a fatal mistake. In this video, we are going to pull back the curtain on this silent killer. I will walk you through the 5 most common, yet most ignored, silent heart attack symptoms that every woman over 60 must know. These aren't textbook theories. These are the real stories I've seen play out in my emergency room, day after day. We will explore why these symptoms happen, why you're so tempted to dismiss them, and what you absolutely must do in the moment they occur. And I urge you to stay with me until the very end, especially for #1 on our list. It is the most frequently misunderstood sign of all, and knowing it could genuinely be the difference between permanent disability and walking out of the hospital to live a full, vibrant life. Before we begin, I want you to think for a moment. Have you ever experienced a strange physical symptom, unusual fatigue, a weird ache, a bout of nausea, and told yourself, "Oh, it's nothing"? Tell me about it in the comments below. Let's start a conversation, because your experience could sound an alarm for someone else. Now, let's begin our journey into understanding your heart. Let's start with number 5, a symptom so common and so easily misinterpreted that millions of women write it off every single day. Unexplained pain in the jaw, neck, or back. It doesn't feel like it has anything to do with your heart. It feels like you slept on it wrong, or perhaps you have a dental issue you've been meaning to check. Let me tell you about a patient of mine, a 68-year-old retired schoolteacher named Eleanor. Eleanor was an avid gardener. She spent her days tending to her roses. One afternoon, she started feeling a persistent, dull ache in her lower jaw. It wasn't sharp, it wasn't debilitating, it was just there. Her first thought was that her old dental fillings were acting up, or maybe it was a sign of TMJ, a jaw disorder her dentist had mentioned years ago. So she took an ibuprofen and tried to ignore it. Over the next hour, the ache didn't go away. In fact, it started to radiate up towards her ear and down into her neck. She felt a growing sense of unease, but the idea of a heart attack never crossed her mind. There was no chest pain, no elephant sitting on her chest. She decided to lie down for a bit, thinking a nap would help. Thankfully, her daughter called to check in, and upon hearing the strange quiver in her mother's voice, insisted on calling an ambulance. Eleanor was having a major heart attack, specifically an inferior wall myocardial infarction, a type that is notorious for presenting with these atypical symptoms in women. Why does this happen? Why would a problem in your heart cause pain in your jaw? The answer lies in a fascinating network of nerves in your body. Your heart has very few nerve endings of its own, so it can't send a precise pain signal to your brain. Instead, it shares nerve pathways with other parts of your body. The vagus nerve, a major nerve that runs from the brainstem down to the abdomen, passes right by your heart, neck, and jaw. When the heart muscle is being starved of oxygen, it sends out distress signals. These signals travel up the spinal cord, and because they converge on the same nerve pathways as sensations from the neck, jaw, shoulders, and back, the brain gets confused. It misinterprets the origin of the pain signal. It thinks the problem is in your jaw or your back, when in reality, it's a desperate cry for help from your heart. This phenomenon is called referred pain. So, how do you know the difference between a simple muscle ache and a heart-related emergency? Look for the context. Does the pain come on suddenly, without any clear physical cause? Does it get worse with exertion, like walking up a flight of stairs, and then ease up when you rest? Is it accompanied by a general feeling of being unwell, a subtle anxiety, or a cold sweat? If a new, persistent ache in your jaw, neck, or upper back appears out of nowhere and doesn't feel right, you cannot afford to ignore it. Do not try to wait it out. Do not book a dentist appointment for next week. This is your body's alarm system, and you must listen to it. Now let's move on to our fourth silent sign, one that is perhaps the most insidious of all because it masquerades as a normal part of life for so many women over 60. Profound and unusual fatigue. This isn't just feeling tired after a long day or a poor night's sleep. This is a bone-deep, soul-crushing exhaustion that comes on suddenly and makes simple tasks feel like climbing Mount Everest. It's the feeling of being completely drained of energy, even if you've been resting. I remember a patient named Brenda, a 72-year-old grandmother, who was the energetic hub of her family. She was always baking, playing with her grandkids, or volunteering at the local library. One week, she started to feel an overwhelming sense of weariness. She was so tired she couldn't even find the energy to make her bed in the morning, something she had done every day of her adult life. She told her husband. She thought she was coming down with the flu. She felt weak, washed out, and had no appetite. There was no pain, no discomfort, just this crippling fatigue. She spent 2 days in bed, convinced she just needed to rest and let the bug run its course. Her family became worried when she wasn't answering her phone. Her son went to check on her and found her pale and lethargic. In the hospital, we confirmed she had suffered a silent heart attack days earlier. The fatigue was her heart screaming for help. The physiology behind this is simple and stark. A heart attack occurs when a blockage in a coronary artery stops or severely restricts blood flow to a section of the heart muscle. Your heart is the engine of your body. When its fuel supply, oxygen-rich blood, is cut off, it has to work incredibly hard just to keep pumping. This immense strain on the heart consumes a massive amount of energy, leaving very little for the rest of your body. The muscles in your arms and legs are deprived of oxygen, leading to weakness. Your brain gets less blood flow, leading to a feeling of fogginess and lethargy. The fatigue of a heart attack is different from normal tiredness. It is often described as paralyzing. Women say they feel as if they've just run a marathon when all they did was walk to the mailbox. It's a complete shutdown of your body's energy reserves. If you suddenly experience a level of fatigue that is completely out of character for you, a weariness that is not relieved by sleep and prevents you from doing your normal daily activities, you must consider the possibility that it is your heart. Do not tell yourself you're just getting older. Do not assume it's the flu, especially if there are no other flu-like symptoms like a fever or cough. This sudden, debilitating exhaustion is one of the earliest and most common warning signs of a heart attack in women, and recognizing it is absolutely critical. This brings us to our third silent symptom, one that is almost universally misdiagnosed by women themselves: nausea, indigestion, or stomach pain. It feels exactly like a bad case of heartburn or something you ate that didn't agree with you. You might feel bloated, queasy, or have a burning sensation in your upper abdomen. Your immediate instinct is to reach for an antacid, drink some ginger ale, and wait for it to pass. After all, you've had indigestion before, and this feels no different. But it can be. Let me share the story of Maria, a 65-year-old who loved to cook. She was famous for her family dinners. One evening, after a modest meal, She started feeling a discomfort high in her stomach, right below her breastbone. It felt like a knot of indigestion. She felt a little nauseous and burped a few times, which she thought was a good sign. She took 2 Tums and sat in her recliner, waiting for the discomfort to subside. But over the next hour it didn't. Instead, a cold, clammy sweat started to break out on her forehead, and she felt a vague sense of dread. Still, the thought of a heart attack seemed absurd to her. The pain was in her stomach, not her chest. It was her husband who, seeing her pale and sweaty, recognized that something was seriously wrong. Maria wasn't suffering from indigestion. She was in the midst of a heart attack. The connection between the heart and the stomach is closer than most people realize. The lower part of the heart, the inferior wall, rests directly on top of the diaphragm, the muscle that separates your chest cavity from your abdominal cavity. The same nerves that supply the stomach and esophagus are in close proximity to the nerves of the heart. During an inferior wall heart attack, again a type more common in women, the distressed heart muscle can irritate these shared nerves, sending signals that the brain interprets as a stomach problem. The key to telling the difference is to look for accompanying symptoms. Is your indigestion or nausea paired with shortness of breath? Are you feeling dizzy or lightheaded? Did you break out in a cold sweat for no apparent reason? Does the discomfort persist or worsen despite taking antacids? Another clue is its relationship to physical activity. True indigestion usually isn't affected by whether you're sitting still or walking around. But cardiac-related stomach pain often worsens with exertion and may ease with rest. If you have what feels like the worst heartburn of your life, and it comes with any of these other signs, sweating, dizziness, fatigue, or breathlessness, you cannot assume it's just your dinner. You must assume it is your heart until proven otherwise. Let's discuss the second silent sign on our list, and it is a terrifying and deeply counterintuitive one. Shortness of breath with little or no chest pain. You might be just sitting in a chair reading a book, or doing something simple like folding laundry, and suddenly you feel like you can't get enough air. It feels like you've just run up a hill, but you haven't moved. You might feel a tightness across your chest, but not the crushing pain you've been told to expect. It's a sensation of being air hungry, and it can be incredibly frightening. I once treated a patient named Susan, a bright and active 69-year-old. She was walking to her mailbox, a short, flat walk she did every day, when she suddenly had to stop and gasp for air. She felt winded, as if her lungs simply wouldn't fill up. She leaned against a fence, her heart pounding, until the feeling passed. She was embarrassed and blamed it on being out of shape. Over the next few days, it happened again, once while she was carrying groceries and another time while she was simply talking on the phone. Each time, she dismissed it, promising herself she would start exercising more. She never considered her heart because there was no classic chest pain, just this terrifying inability to breathe. It was only when she became so breathless she couldn't speak in full sentences that her daughter rushed her to the ER. Her main coronary artery was over 90% blocked. The breathlessness was her heart failing. The mechanism behind this is critical to understand. Your heart has 2 primary jobs: pump oxygenated blood out to the body, and receive deoxygenated blood back from the body to send it to the lungs. When a blockage prevents the heart from pumping effectively, blood starts to back up in the system. This backup causes pressure to build in the blood vessels of the lungs. Fluid can begin to leak from these vessels into the air sacs themselves, a condition called pulmonary edema. In essence, you begin to drown in your own fluids. This is what causes that desperate feeling of not being able to get enough air. Your lungs are working fine, but they are becoming waterlogged and cannot perform the gas exchange your body needs. For many women, this can be the only major symptom of a heart attack. If you find yourself suddenly out of breath doing a simple activity that you could easily do yesterday, or if you wake up at night gasping for air, this is a red alert medical emergency. It is not just a sign of aging or being out of shape. It is a cardinal sign that your heart is under extreme distress and is struggling to do its most basic job. And now we come to the number 1 most overlooked silent heart attack sign in women over 60. It's a constellation of symptoms that are so vague, so easily attributed to something else, that they are ignored until it is often too late. A sudden onset of dizziness, lightheadedness, and a cold sweat. You might be sitting perfectly still when the room suddenly begins to feel unsteady, as if you might faint. At the same time, you may feel a sudden, profuse sweat that is cold and clammy to the touch, completely unrelated to the temperature in the room or any physical exertion. It feels like the onset of a terrible flu, but it happens in an instant. This is what happened to Carol, a 71-year-old who was watching television with her husband. Out of nowhere, she was hit with a wave of intense dizziness. She gripped the arms of her chair, feeling like she was about to pass out. Her husband noticed that her face had gone ashen gray and that beads of sweat were pouring down her temples. Even though the room was cool, she felt a profound sense of doom, an indescribable feeling that something was terribly wrong. She didn't have any pain, just this overwhelming physical collapse. Her husband, remembering an article he had read, immediately called 911. That call saved her life. Carol's blood pressure had plummeted as her heart failed to pump, causing the dizziness. The cold sweat was her body's fight or flight response kicking in, a primal reaction to a catastrophic internal event. These symptoms, dizziness, fainting, and a cold sweat, are signs of a massive physiological crisis. When a major artery is blocked, the heart's output drops dramatically. This causes a sudden fall in blood pressure, which means your brain is not getting enough oxygenated blood. This is what causes the lightheadedness and the feeling that you are going to faint. The nervous system recognizes this as a life-threatening situation and triggers a massive release of adrenaline. This adrenaline rush is what causes the clammy, cold sweat and the feeling of impending doom. It is your body's last-ditch effort to keep you conscious. If you experience these symptoms together, there is no time to wait. Do not lie down hoping it will pass. Do not drink a glass of water. This is the most urgent of all scenarios. It often signals a very large and dangerous heart attack is in progress. So now you know the 5 silent assassins: jaw, neck, or back pain, profound fatigue, nausea or indigestion, shortness of breath, and dizziness with a cold sweat. Recognizing them is the first crucial battle. Winning the war depends on what you do next. Your action plan must be simple, immediate, and unwavering. The very first and most important step, the moment you suspect any of these symptoms could be your heart, is to call 911. Do not call your daughter. Do not call your neighbor. Do not decide to drive yourself to the hospital. You must call for an ambulance immediately. Why? Because paramedics can begin life-saving treatment the moment they arrive. They can administer oxygen, give you medication, and use a defibrillator if your heart stops. The emergency room on wheels comes to you. Furthermore, heart attack victims who arrive at the hospital by ambulance are treated much faster than those who walk in. Time is muscle. Every minute that passes, more of your heart tissue dies. Making that call is the single most important action you can take to save your own life. When you speak to the 911 operator, be clear and calm. Say, "I am a woman over 60, and I think I am having a heart attack." List your symptoms clearly, even if they don't include chest pain. The second step, while you are waiting for the ambulance to arrive, is to chew 1 adult-strength, 325 milligrams, aspirin. Do not swallow it whole. Chew it. Aspirin is a powerful antiplatelet medication. A heart attack is caused by a blood clot blocking an artery. Aspirin helps to stop that clot from getting bigger, and can even help to break it down, restoring a small amount of blood flow. Chewing it, rather than swallowing it, allows it to be absorbed into your bloodstream much faster, through the linings of your mouth and stomach. This can make a critical difference in the first few minutes. However, do not take aspirin if you are allergic to it, if you have a bleeding disorder, or if your doctor has specifically told you never to take it. If you are unsure, wait for the paramedics to advise you. The third step is to unlock your front door. This seems small, but it is vital. It allows the paramedics to get to you without delay. After you've unlocked the door, sit down in a comfortable position, preferably in a chair with your back supported. Do not lie down flat, as this can make breathing more difficult. And finally, try to stay as calm as you possibly can. Take slow, deep breaths. Panicking releases adrenaline, which puts even more strain on your already struggling heart. Your job is to be the calmest person in the room until help arrives. You have done everything you can. You have recognized the signs. You have called for help. and you have taken the first steps to fight back. We have covered so much ground, and I know it can be overwhelming. But this knowledge is not meant to scare you. It is meant to empower you. For too long, women have been left out of the conversation about heart health. We have been handed a playbook that was written for men, and it is costing us our lives. The pain in your jaw is not just a toothache. The exhaustion is not just old age. The nausea is not just indigestion. These are potential signals from the most important muscle in your body, and you now have the tools to decode them. Your body speaks its own language, and it is up to you to listen to it with attention and respect. You must become your own best advocate. You must have the courage to raise your hand and say, something is wrong. Even if you can't perfectly describe it. Trust your intuition. Women often have a powerful sense that something is amiss, even when the physical symptoms are vague. Do not let anyone, not even yourself, talk you out of that feeling. You are not an inconvenience. Your health is not a burden. Taking action to save your own life is the most important thing you can ever do, for yourself and for all the people who love you. So let's recap the 5 silent signs one more time. Number 5. Unexplained pain in the jaw, neck, or back. Number 4. Profound, paralyzing fatigue. Number 3. Nausea or stomach pain that feels like indigestion. Number 2. Shortness of breath without significant chest pain. And number 1. Sudden dizziness, lightheadedness, and a cold sweat. Burn these into your memory. Teach them to your sisters, your mothers, your daughters, and your friends. By sharing this information, we can begin to change the narrative and save the lives of the women we love. A heart attack doesn't have to be a death sentence. It can be a survivable event, but it requires awareness, knowledge, and immediate, decisive action. You now have all 3. I want to hear from you again. In the comments below, tell me which of these 5 signs surprised you the most. And do you have an emergency plan in your home? Do you keep aspirin readily available? Sharing your preparedness tips could give another woman a life-saving idea. Thank you for taking this time for yourself, for your health, and for your future. Stay safe, stay prepared, and listen to the whispers your body sends you. They may be the most important words you ever hear.